Hey guys, I'm Daniel Aragon, and today we're going to be talking about Medicare and Medicaid. What are their similarities and what are the differences between Medicare and Medicaid? Medicare and Medicaid are two government funded health insurance programs that provide coverage to millions of Americans. While they are often discussed together, they are actually very different, and there are several key differences between the two programs, and it's very important to understand those differences. So let's first look at what Medicare is. Medicare is a federally funded health insurance program that provides coverage for individuals 65 years of age or older, as well as some younger individuals who have disabilities. There are four parts to Medicare: Medicare Part A, Medicare Part B, Medicare Part C, and Medicare Part D. Medicare Part A covers hospital stays and inpatient care. The way you remember it is hospital with a capital A, hospital, so Part A. Part B covers doctor visits and outpatient care. Part C allows beneficiaries such as yourself to choose a private insurance plan that provides all of the benefits of Medicare. And Part D covers for prescription drugs. D for drugs. Now let's talk about Medicaid. Medicaid is a joint federal and state program that provides health insurance to low-income individuals and families. It is funded by both federal government and the state in which beneficiaries reside. This is why there are differences in levels of care from state to state. Why? Because some patients qualify only for Medicare, while in some states some patients will qualify for Medicaid, while in other states patients will not qualify for Medicaid. Also, it's a legislative process, so in some states, the Medicaid will be expanded in some states, and some states have voted for the non-expansion of Medicaid. One key difference between the two programs, Medicare and Medicaid, is that Medicare is primarily for those who are 65 years and older, or those who have certain disabilities such as end-stage kidney disease who are in need of dialysis. While Medicaid is for those on low-income individuals and families regardless of age. One key difference between the two programs, Medicare and Medicaid, is that Medicare is primarily for those who are 65 years and older, or those who have certain disabilities, while Medicaid is for low-income individuals and families, regardless of their age. Another difference is that Medicare is a federally administered program, while Medicaid is a joint federal and state program. This means that the federal government sets the overall guidelines for Medicaid, but each state has the flexibility to design its own program within those guidelines. This can result in some variation in coverage and eligibility from state to state. In terms of the benefits covered by the two programs, Medicare provides a wide range of medical services, including hospital stays, doctor visits, and prescription drug coverage. Medicaid, on the other hand, covers a more limited range of medical services, but also includes services such as long-term care and home health care. Medicaid also covers certain populations that are not covered by Medicare, such as low-income children and pregnant women. It is important to note also that some individuals may be eligible for both Medicare and Medicaid, depending on their income and other factors. In cases where you are eligible for both Medicare and Medicaid, Medicaid can help cover out-of-pocket costs that are not covered by your Medicare. Overall, while both Medicare and Medicaid are important programs that provide vital health insurance coverage to millions of Americans, they serve very different populations and offer different types of coverage. It is important to understand the differences between the two programs in order to determine which one is right for you and your loved ones.